LD-215C. Inhalation therapy is an efficient remedy for respiratory conditions. It is widely used worldwide. Little Doctor offers LD-215C, an advanced compressor nebulizer for home or clinical use. The LD-215C compressor nebulizer combines a plain look, advanced technology, and includes an extensive range of accessories. Although the compressor does not significantly heat up during operation, it has an overheating protection feature. With an efficient air cooling system and anti-vibration motor mounts, the high-performance device is compact. The powerful motor is designed for unlimited continuous operation. The LD-215C compressor nebulizer supports a wide range of medicines, including antibiotics and corticosteroids. The nebulizer is breath-activated and uses the expensive medicines most efficiently thanks to the low residual volume of the inhalant. The inner ducts of the breath-activated nebulizer redistribute the airflows. For inhaling, the aerosol enters the human respiratory tract, while for exhaling, the aerosol is not just vented, but collected in the nebulizer for the next breath in. An important factor of inhalation therapy is delivering the medicines exactly to the right part of the respiratory tract. It makes the therapy much more efficient, while reducing the exposure of healthy organs to the inhalant. For this reason, the LD-215C nebulizer comes with 3 exchangeable atomizers. Atomizer C, red, produces the largest particle aerosols that settle in the upper respiratory tract as required for the therapy of sinusitis, laryngitis, or ARVI, etc. Atomizer A, yellow, produces the smallest particle aerosols. Only these particles can reach the lower respiratory parts for the therapy of such conditions as bronchitis and asthma. Atomizer B, blue, general purpose. The particles generated by the blue atomizer are evenly distributed across the human respiratory tract. The curve shows that the total mass of the yellow atomizer particles reaching the alveoli is almost 100% higher than that of the red atomizer particles. Conversely, only the red atomizer can produce aerosol with large particles as required for the upper respiratory tract therapy. The device is easy to use. Inhalation procedure. Install the atomizer as required. Pour the inhalant into the bottom of the nebulizer. Connect the mask, mouthpiece, or nose tip. Turn the device on. The extensive set of accessories includes 2 masks for adults and kids, 3 atomizers for specific parts of the respiratory tract, 2 nose tips for adults and kids, 2 mouthpieces, and a carrying bag for the nebulizer and its accessories.